Coming up on today's Morning Medical Update, the community is still mourning the loss of Curtis, a beloved gorilla who passed away earlier this month at the Kansas City Zoo. It was 1 year ago today, though, when a team from here at the University of Kansas Health System answered a call for help that gave Curtis another year of life. Good morning. It is Friday, October 28th. I'm Jessica Lovell, and we are here live inside the Dolph C. Simons Jr. Family Broadcast Studio. We're so glad you are with us today. It was an unusual patient for our health system team, but whether a human patient or a primate, this expert team was humbled to be asked to help out. We know that this story will bring in a bunch of questions. We certainly had them too, so get them sent in through the links here on your screen, or you can drop them in the chat thread below. We'll get to those here in just a few moments. While it was not the outcome anyone had wanted, Curtis's life had immense value, and he was loved by his zoo caretakers and the entire community. 28-year-old Curtis died of heart failure October 8th, just shy of the 1 year from the surgery that helped give him another chance at life.
Never did I think I'd be operating on a gorilla in my wildest dreams.
Urologist Dr. Josh Broghammer speaks for a whole team from the University of Kansas Health System called to the Kansas City Zoo for an emergency operation. It's not the typical patient these doctors and nurses roll into the operating room.
We're going to do right radical nephrectomy, antibiotics, you already gave? Yes. Great.
This team, who normally works to save the lives of humans, is using their combined expertise to help save the life of Curtis.
All right, if everybody's ready, we're ready.
A 400-pound gorilla.
First time for everything, right?
Urologist Dr. Jeff Holzbeierlein leads the team.
Curtis is having a retroperitoneal bleed, so we believe that it's coming from his right kidney. We're certainly concerned that it's a cancer of the right kidney, and that's what's bleeding. So the goal is to get the kidney out.
It's a community effort that started, where else? Like many things, on social media.
There was a call that went out to see if there was a urologist that might be available to help with kidney surgery. In the meantime, I also started getting texts from other people.
It's different in the fact that it's at the zoo, but it's no different than your colleague calling to ask you for help.
Cardiologist Dr. Tim Beaver agrees to monitor Curtis's heart, and in less than 48 hours, they assemble here outside the zoo's OR with Dr. Kelly Varner, veterinarian and anesthesiologist with the University of Missouri-Columbia.
Anesthetizing gorillas is actually kind of the furthest thing from normal for us because they're the most like people and the least like our other mammals.
Adding to the worry, Curtis has had COVID.
And so we're really trying to assist with knowing what the animal's risk is going into the surgery.
I think this is where we need to be right there. What do you think?
The team goes to work to remove the diseased kidney.
I'm going to dog paddle here just a little bit.
Yep.
And 5 hours in, the kidney is finally out.
It's sort of a morale booster to kind of rally around something like this.
A boost for this team, more time for Curtis.
But it is really exciting there's very few people obviously outside of a zoo that get this close to a gorilla.
And for Dr. Holzbeierlein, it's one for the books.
The uniqueness and the ability to tell my children and grandchildren about this in the future is not lost on me either. I'll never have an experience like that before again, so thank you for the opportunity. Thank you for saving our girl. Oh, my pleasure.
And we are joined now by Clinical Service Chief of Urology, Dr. Jeff Holzbeierlein, Surgical Urologist, Dr. Danica May, and Dr. Sean Kumer, Transplant Surgeon and Physician VP of Perioperative and Procedural Services, all here at the health system and all who played a part in helping Curtis endure another year. So, docs, take us back to that initial conversation that had to have happened to assemble a team of medical staff here at the health system to help operate on a 400-pound gorilla. Certainly not your everyday conversation, Dr. Kumer. What did Dr. Holzbeierlein say to you when he came to you? What was that call like?
Yeah, my role was completely supportive. So, Dr. Holzbeierlein came to me and he said, well, first of all, and I operate with Dr. Holzbeierlein and Dr. May all the time on humans. And so I know them well. And when Jeff said, the first thing he said is, this is a call that you're not going to expect. You're not going to believe what I'm going to tell you. Maybe a little more color than that. But nonetheless, it was, it started, obviously, this story. And it was pretty neat. He's like, I need support. We need instruments. We want to do this. And of course, if anybody knows Jeff, goes, and I want to do it now. And so we got there. It took a little bit of time. And actually we learned a lot. We thought that instruments could go over there and then be washed and come back over here. That's not the case. They have to be left there. Once they're operating on an animal, you can't do that. So we had to figure out a lot of things and get the supplies. So the health system donated instruments, and obviously Jeff and Danica and their teams, they donated their time and their people, and they can tell you more about that. But my role was pretty minimal in this, and I was glad to support the team in any way we could.
Dr. Holzbeierlein, so where did this story all begin? I can't believe it was Facebook or something, some sort of group, but I mean, like I said in my story, I mean, doesn't everything kind of start on social media in some way, or it leads to social media some way or another?
Yeah, so for my perspective, I was actually walking into the hospital to do surgery on humans that day and get a call from one of my partners, and that was Dr. Josh Broghammer. His wife, Dr. Carrie Winnicky, who's the chair of OBGYN, had received the Facebook message that said, does anybody know a urologist who might be willing to perform a kidney removal surgery or nephrectomy on a gorilla at the Kansas City Zoo? And so, of course, she reached out to him, who then reached out to me, and my answer was absolutely. Let's get this going.
So you said absolutely before you talked to Dr. Kumer?
I did say absolutely before I talked to Dr. Kumer.
I want to be clear about that. Surprise.
Yeah.
So Danica, tell us how, Dr. May, excuse me, tell us how you got involved. And I would imagine there were a lot of people who wanted to be involved, but what got you to that OR room that day?
Well, fortunately, I was still a urologic oncology fellow at that time and was able to pull some strings and be Dr. Holzbeierlein's shadow. So that's kind of how I jumped on board as, we'll say, supportive. I offered to take pictures and things like that, and then it was kind of all hands on deck once we got there.
Was it kind of surreal? You've been talking about it, you planned for it, you lead up to it, Dr. May, and then here you are in there with this like orchestra of people, right?
I would say it's very surreal. You know, it was very interesting to talk to the anesthesia team from Missouri and kind of think about some of the medical things that go into, you know, anesthetizing and operating on a gorilla, but just learning from her expertise and seeing how similar the anatomy was to humans, all of that was just, it was fascinating.
Dr. Holzbeierlein, yeah, what were the roles? I mean, here you are, there's so many people standing around you, and you were able to call out and ask for anything and everything, and did it feel like you were in an OR here at the hospital?
Yeah, you know, it's a really interesting question, because clearly up until we really started surgery, Kirk, the head veterinarian, really ran the show. I mean, he knows more about these animals than, you know, probably most people on Earth. Once we started the surgery, then it really became very much like the operating room here at the University of Kansas, and that's where, you know, everybody plays a role. Everybody sort of contributes their expertise, whether that's you know, our nurse that was with us that was helping you know, keep the cautery pad on a gorilla, which was a challenge, to our scrub tech Eli Bozarth, who, you know, was providing some complicated instrumentation we were allowed to take out there so that we could complete the surgery safely.
Well, talk about the anatomy. What was the same? What was different? What did you expect that maybe you were surprised by?
Yeah, so certainly when you're operating on a person or anybody that's 400 pounds, you're going to expect a fair bit of adipose or fatty tissue. That's very different in a gorilla. Gorillas don't have any fatty tissue, so no fat at all. Otherwise, the anatomy was quite similar. They do have a lot more bowel gas than humans do, and that made it a little bit technically challenging for us, just because we don't have all of our normal equipment. We didn't have a retractor, for example. So that's where the team really jumped in. Everybody kind of had their role in terms of helping expose the tissues so that we could complete the surgery safely and successfully.
Let's go back to the planning, because this is interesting. And Dr. Kumer, you said, you know, it starts with, you know, we got to start with instruments and the staff, and this is all happening during a pandemic, and I know this was all off time that you all donated to the zoo, but just kind of talk amongst yourselves and explain how the lineup that had to happen to make this all come together, including the communication with the zoo.
Yeah, I mean, you know, it's really quite honestly very similar to what happens oftentimes when we're maybe faced with a challenging case on a human patient. You know, oftentimes I think I communicate with Sean regularly if I have something that's challenging, whether needing his assistance during a surgical procedure or as the head of the surgical services, you know, his expertise or assistance in sort of getting the necessary equipment to get, you know, the job done, quite honestly. And so Sean's always incredibly responsive and helps us to make sure we have the best outcomes. And it was very similar. I got on the phone, I gave him a call, told him, for the first 3 or 4 minutes, he thought I was joking. He asked if it was April 1st, and once we were able to assure that this was not, he wasn't being pranked, then we sort of started mobilizing the team, and he was incredibly helpful in helping us do that.
Once you got to the zoo, was there any communication back here at the health system? Was there any need to call Dr. Kumer, or was he just like, you're on your own, go do it, go save this gorilla?
These guys are professionals, right? They had their team, they're ready to go. They had some challenges when they were there, and I can elaborate on that maybe a little bit, but I was actually, I wasn't involved. I actually was calling the people in there just checking on things. So I was at home. And
I think you texted me a couple of times. You and I were going, have you heard from anyone?
Yeah,
and,
I was just curiosity and interest and hoping the team was doing okay and those types of things. But it was pretty interesting. I mean, some of the things that you kind of alluded to about these instrumentation issues. Well, I mean, you can imagine we have beds here at the hospital, operating room beds, and they have rails, and that's what we attach our retractors to. Well, we can't bring one of those. Those are too rickety for this large animal. And they had, obviously logistically difficult to get there, but they had a bed, but there were no rails, so they couldn't use retractors. So there were a lot of tired folks manually retracting so everybody could work. And it was, well, these guys could elaborate. They were probably wiped out for a few days.
Dr. Holzbeierlein, I know you mentioned you were worn out. Your back, you said, was kind of hunched over by the time you got, as you walked away, because you were standing over Curtis for so long, right?
Yes. I mean, there's a picture that Danica, I think, took with me at the end, and it looks like I'm sort of bending over to take a picture with the gorilla. I'm really just bending over because it was too painful to straighten up. We were tired. Again, the operating room at the zoo is very different from what we're used to here. The temperature different, things you don't really always consider when you're operating, in a hospital. But it was very warm. The bed doesn't move like it normally does, so the height and the ability to roll the bed to our side to assist us was not present. And all those things, again, just make it challenging. In addition to being just a technically challenging surgery for the condition that Curtis had. You
were just learning as you go. Dr. May, surgeons have to consider all sorts of health issues. We'd mentioned earlier that Curtis had COVID before. What other health issues did he face? Anything else that concerned you? And you were taking this kind of, you had an interesting view to see everyone, but what other concerns were there in the OR room?
I think, Kirk, the veterinarian, was very helpful with that. Curtis was, essentially a geriatric gorilla for his age, and so that was of concern, is that he was, fairly old to undergo such a surgery. Additionally, he was very anemic, and that was kind of what started this whole investigation and found the kidney issue, was that his blood counts were very low. He received the first, or one of the first, blood transfusions for gorillas, and that was definitely on our mind going into the surgery. Was he doesn't have a lot of reserve as far as blood counts, and they were having to get blood donations from his brother, who also resides in the zoo. So lots of logistical things as far as being very careful with blood loss and things like that. And then the anesthesiologist really took that into consideration with anesthesia and medications that were administered, because he just didn't have a lot of reserve and had to be very careful with that.
Dr. Holzbeierlein, what exactly did you do to Curtis? Kind of help us understand it in the most layman of terms. And then I want to show a photo after you brought the kidney out. We'll share that here in just a moment. But exactly what procedure did you perform?
And so the assumption, or we were relatively sure, because we actually did have a CAT scan from the spring, was that Curtis had developed a bleed within his kidney. And that was what was leading to his blood counts being very low and then being anemic, as Dr. May mentioned. Had that continued, that would have ended Curtis's life pretty quickly, within days. So the procedure that we did was removal of the right kidney, which we call a radical nephrectomy. That's done very commonly at our health system for patients typically with kidney cancer. So we were very suspicious that this was a cancer of the kidney that was causing this bleed. And so, in a standard fashion that we might take in a large kidney tumor in a patient, patient. We made an incision under his ribs and then went in and were able to disconnect the kidney from its blood supply and then remove it. One of the really challenging components of this procedure was because the original bleed had happened back in the spring about 6 months prior, that causes a lot of scarring around the kidney, and that made the procedure technically challenging. If you imagine sort of pouring super glue on something, that's sort of what it was. It was sort of like it had been super glued into the area behind his intestines. So again, made it challenging to actually remove the kidney.
So Curtis's kidney, as you mentioned, it was sick. I want to show two pictures. The first one is going to show a kidney of what it looked like originally. Turn away if you don't want to see the kidney out of Curtis's body. But Dr. Holzbeierlein, describe kind of what we're seeing when we see this, when you brought it out. Very large, right?
It was. So kidneys oftentimes, I would say normally, if you think about a kidney, human kidney, it's about the size of your fist. And that's true for a gorilla. They're actually very similar in size, almost exactly. This one was diseased and obviously, as I mentioned, had a lot of scar tissue and blood around it. And that ended up making it about the size of a rugby football, if you're familiar with rugby, a little bit larger than an American football. And that was about the size of the kidney when we removed it.
And then let's show the picture. What are we seeing here?
So what we did in this instance was we split the kidney in half after we had removed it on the back table, just to look to see if we could identify perhaps a large tumor that was causing that. And the dark area there that you can see is actually the blood. So you can see that that was what had tipped off the fact that he was bleeding again. That's in the central portion of the kidney, and Curtis was having a lot of blood in his urine. And that's what you're seeing in that sort of central picture. In fact, there did not end up being a cancer, which is great, but it was probably from a fall that Curtis had had at some point that caused this abnormal bleeding that just continued.
But it needed to come out, correct?
Absolutely. Again, when we started the procedure, as Dr. May mentioned, Curtis's hemoglobin was 5. Normal is 13. Mm-hmm. In a human patient, if your hemoglobin was 5, we would have you in the intensive care unit massively transfusing you. So that just tells you the sort of dire situation that Curtis was in.
So Dr. Kumer, you perform liver and kidney transplants. You take them out. What were your thoughts when you saw the pictures? What questions did you have for Dr. Holzbeierlein when this was all complete?
Wow, that question came from left field. I probably should have looked at the script beforehand, but yeah. So yeah, I mean, obviously this is not a common thing that happens in humans, but nonetheless, it can happen. Respiratory hematomas occur. That would be something that a urologist would deal with if necessary. But nonetheless, this is. It's pretty impressive. I mean, I got to see some of the pictures after the fact, and it was just incredible.
Well, here's another one. I have another one from left field.
Yeah.
Are you ready?
Yeah.
You said we learned a lot. So what do you think one of the biggest takeaways was this for just this collaboration? I mean, I think one thing that we love about this story is to see a community coming together through social media, the zoo, our health system, everybody coming together kind of in this beautiful humanity. What do you think the biggest takeaway, or one of the biggest takeaways was?
Well, I think you see the heart of our people here at KU. I mean, at the health system. When people ask for help, people jump up and they do it. And this is a glaring example of that, but this happens every day here at the health system. When I need help with a case, I call professionals that know this area better than I do. And likewise, we do that all the time. The collaborative nature of our faculty and staff is incredible. There are combo cases going on in the ORs every day, and that demonstrates the incredible comprehensive care that we deliver here, and the willingness of people to move their schedules, their busy schedules, and coming out of clinic, come out of their ORs and move their schedules around just to help a patient. Well, and I think that's the most important
no discriminating
story.
When it comes to patients. We've always said that. Somebody puts out the call and asks for help, and we help, even if it's a gorilla. Hang tight. I want to check in with Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. I want to get a quick check on our COVID count this morning. Good morning. How are you?
Yeah, hi. I want to get back to the story, but
I know.
We'll do this. So right now, 23 active infections in the hospital, 4 in the ICU, 1 on the ventilator, still 20 in that recovery period. So the numbers have gone down. Hopefully that was just a little blip and very transient, and we can continue to see lower numbers moving forward for the time being.
Okay, couple headlines real quick. Some are predicting what's being called a triple-demic, expecting a winter rise in COVID, added to flu, now with a rise in RSV. What do you make of that? Something we should be concerned of? And do we know the numbers here by chance?
So first of all, for the first question, I think we do need to be concerned. Certainly for the very young and the elderly, RSV can cause a lot of problems. We know that. Or if you are immunosuppressed as well, we do see that. Me and my partners do see that up on the floors also. And what are our numbers here? The numbers for hospitalized patients for flu is still fairly small in the single digits, but we know that our testing, for instance, in the emergency departments or in the ambulatory settings, the clinics are increasing as well. And then for RSV, we are also seeing, I was able to talk to Dr. Michael Lewis a couple days ago, we are seeing an increase in those cases as well. So again, for those very young, RSV is certainly a problem. We know that influenza can cause very severe disease as well. And then of course COVID. So it's vitally important to protect yourself and continue to get vaccinated against those. Get that booster and get that influenza vaccine now.
Doc Hawk, I know you work closely with HIV patients. An estimated 1.2 million people in the U.S. live with HIV. Research now showing 13% do not know their status, but we know knowledge is power. So walk us through some of the alternatives when it comes to long-acting HIV prevention and possible new treatments.
Yeah, obviously prevention is the best thing. So, talking with your partners, if you're meeting new partners, be open about that. Most of my patients are very responsible and very open about that. So trying to prevent. Also, if you are engaging with interactions with different people, it is important to talk to a doctor about getting on pre-exposure prophylaxis or PrEP, which is a pill you can take daily to help prevent HIV should you be exposed to it. So prevention is always the best, and of course, getting tested is vitally important. Getting tested routinely. Again, if you are doing out not in a monogamous relationship, out having sexual interactions with people, testing regularly, because we have very safe, very efficacious, very easy to take medications, and that will keep you healthy, because we know people with HIV who, when it is prolonged and progresses to AIDS, you have a reduced immune system, you have higher risk of cancer, higher risk of heart disease, and other things of that nature. So it's vitally important to get tested and get on treatment early. The treatment we have, the treatments that we have now, very easy to take, very safe, very, very little side effects, and there are a number of options for that.
Doc Hawk, thank you so much. Do we have any reporter questions on the line today? Let's get to some viewer questions today. And Lisa wants to know, how did you select the staff? We talked about, I'm sure, Dr. Holzbeierlein, there were a lot of people very interested in this case as well, but how did you select, and how did people approach you, or did you approach them?
Yeah, so that was really a very critical component of what we did, and it does go back to what Dr. Kumer said earlier, and that is that we're very used to working across lines and putting teams together to get the necessary expertise to complete complex surgeries, which we do very commonly here at the University of Kansas Health System. So, that was no different really than what I might do for a complicated case in the OR here. And so we put together a team that was familiar with working with each other, that was familiar with crisis or difficult situations, and people that we could count on. And that was again, an easy team to assemble. There were lots of people who wanted to go and participate. Obviously, the opportunity to participate in Curtis's Care was, again, a once-in-a-lifetime event. But ultimately, what we had to do was put together a team that was going to be successful, worked well together, so that we could have the best outcome.
Dr. Kumer, Jim wants to know, did you have any concerns when Dr. Holzbeierlein called? Was there just anything that went through your head that thought, this might be an issue, or we got to look a little bit deeper into that? I know this isn't something we would take lightly. We got to really work through all of the issues that are involved.
Yeah, absolutely. a lot of the calls I made, and it takes time. We talked to regulatory, we talked to legal, we talked to obviously our media team. There was a lot of things behind the scenes that, beyond the team that was busy trying to plan this once in a lifetime event that was scary, exciting, and ultimately beneficial for Curtis. There was a lot of things happening behind the scenes as well. The concern for our team members going there, and that experience could be bad, right? It could have been a lot different if something else horribly happened. For instance, the animal woke up. Right. Those types of things, and in these two professionals here, they tend to be folks that run towards fires, which is great. That's why they're great at their jobs. And but the other stuff is we want to protect them and make sure everything goes well.
That's your job.
It's my job and everybody else's job around them as well. And it's really important to get that team, everybody on the same page. I can tell you, everybody was, how can we do this? Now, how can't we do this? Which was great.
So on that note, Dr. May, there was a question from Cindy, and she wanted to know, as you were sitting there observing, taking photos, helping where you needed to be, was there any concern? I mean, we know we had a really great anesthesiologist from MU there, and I know Dr. Holzbeierlein, you said you put full trust in her as you would, but did there anything that sit in the back of your head, Dr. May, when it came to being in the same room with a 400-pound gorilla?
I think the most interesting part about the anesthesia side of things was that they did not paralyze Curtis. So we had very explicit instructions not to put our hand within his hand because he still had the ability to grasp and could break fingers or break your hand. So, I think it was just really, careful communication from the anesthesia team, trusting them, knowing that they know what they're doing while this is a little bit out of our league dealing with gorilla anatomy and physiology. Yeah. We trusted our anesthesia team and really just paid attention to what they told us and kept our hands away from his hands.
And Dr. Holzbeierlein, we don't have the photo, but you had told us about that story about how you wanted to put your hand up to his hand. Walk us through that. What did you say?
I think it is difficult when you're when you're around something that's that large. It's again, as people have said, it's sort of surreal. And so putting my hand up to his hand just to see what the enormous difference between a human and a primate like Curtis is. Again, that was really fascinating, and honestly, I think Dr. May made an interesting point. We typically give muscle relaxants during surgery, and that was not given in Curtis because we weren't sure if that would be safe for him. So he did have the ability to theoretically wake up, and again, I think that talks about the team we put together and trusting our anesthesiologist. Again, something we do every day, but I never felt like I was in danger. I never felt like I was, in harm's way at any point in time.
Did he twitch at all during the surgery? Was there any movement? Because that would seem very scary.
Yeah, not in the area in which I was operating. You have to remember I was pretty focused in on a pretty small area, so I wasn't looking at his hands or feet. They tend to grimace a little bit, and I think that was probably going on. And again, that was something the anesthesiologist was monitoring to sort of keep his to keep him completely anesthetized. So again,
so he felt no pain.
Didn't want Curtis to have any pain. Didn't want him to have any sense of awareness of what was happening.
Question. Joellen wants to know, what's a retractor?
So a retractor is an instrument. So back in the old days of surgery, we'd have trainees would always hold on to instruments to kind of retract and hold open, like the outside skin, for instance, which is sort of what this team had to do because there was not a mechanical retractor. A mechanical retractor is something that hooks on to usually the bed frame and then is able to hold the operative field open without somebody manually doing it.
So we're going to get to final thoughts here in just a moment. Dr. May, just what is your biggest memory that you're going to take away from this experience, this big learning moment for you?
I think it was just an amazing experience, and to help care for Curtis and reach out when the zoo needed help and needed expertise with kidney surgeons, and just the collaborative experience that we've all been alluding to was just amazing. And I think I view the zoo in a new way that I never would have viewed it before. Going there now after having helped with Curtis is just a whole different side of things, and you just really feel connected in a way and kind of see the humanity coming together, as well as kind of that softer side of the animals that maybe you don't see from through the glass. So I think it was just an awesome experience.
Really well said, through the glass, because you're right, we get a certain view, but not the view that you had. Dr. Holzbeierlein, are there any stories that I haven't asked you about? I know you've had so many and you've shared them and they're so wonderful, but is there anything that I haven't asked you about that you wanted to share about your day in the OR out there at the zoo?
Yeah, again, I think just an incredible experience. And, one of the things that really drove home for me, you have to remember this happened during the height of COVID. Mm-hmm. And, I think we talk a lot about loss of community and how when we are not able to sort of be together as much as we want, how that can affect us. And this was a great example of when you have community working towards a common goal, how fulfilling that is. And I think everybody came away from this experience because, again, even doing the surgery and getting through the surgery, weren't sure what the outcome was going to be, whether Curtis would recover. But again, I think all of us sort of felt, again, as that team or, again, that community. And that was really important for everybody that was involved.
Dr. Kumer, final thoughts today?
Yeah, I'm just proud of this team. They did an incredible job, right? They ran towards the fire. They answered a call. They helped out, our community. They worked as a team together. I don't think I'll ever forget the call that I got from Dr. Holzbeierlein. That was pretty shocking. I'll always remember that call. And then right after I had that call, ironically, I was right outside the executive office, and the senior team was having a meeting in the front office, and the door was open, and I just popped my head in, and I told them, I said, our team's going to be operating on a gorilla. I just want to let you know about that. And they all looked at me shocked, and their jaws dropped down, and they immediately said, well, go figure it out.
Yeah.
And so it was great. It was great to have that support, and I think that just embodies everybody did here.
Go figure it out. That's what we do. Dr. Holzbeierlein, any other final thoughts you want to share with us today? And I'm sorry, I had to add that because when I talked to you standing outside the OR that day, a year ago today, by the way, you said this might just be what my kids and my grandkids remind. Yeah, I bet your kids at school are like, did you know my dad? He operated on a gorilla. So what has this experience been like from you, just from all standpoints?
Yeah, I mean, it has been something that, actually when the story aired on the news a couple of weeks ago, I think people got confused between what Holzbeierlein they were calling. And so my daughter was actually getting phone calls in college, people saying, can you operate on a gorilla? And she's like, no, that's my dad. So, I'm not sure I do a lot of things that they always know about. And
right.
So for them to kind of hear that I got to go do this, I think that they were proud of that. Yeah. And so that was really fun to share with them.
Yeah, your dad does a lot of great things. This is just one real cool one that we got to share. So thank you all. Dr. May, anything else you want to add before we head out today?
No, just an awesome experience, and I'm glad the zoo reached out and that we were able to help.
Dr. Hawkinson, final thoughts.
Yeah, just another example of what we've been talking about throughout these last couple weeks when we talk about the care teams. I'm so privileged to be able to work here, and it's important for you, the patients, and your loved ones to know that we are all collaborating together. It's not a single person treating you. You have a whole team behind you who is really looking out for your best interest to get you better and get you home safe.
Doc Hawk, thanks so much. Have a great weekend. And thank you so much for being with us today. You can catch our updates anytime by logging onto Facebook, YouTube, and Twitter. Have a great weekend, and we will see you back here Monday at 8 o'clock. Coming up Monday on the Morning Medical Update, witches, superheroes, and pirates. Oh my. Halloween is here, but trick-or-treaters might not be the biggest scare. I'm Jessica Lovell. How to keep you and your kiddos safe from lurking viruses. And for those with a weak heart, do those scares really put you in jeopardy? Join us Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.